आश्रम भी आज बहुत ज़्यादा सेलिब्रेट कर रहा है क्योंकि उनके शिष्यों का आज बर्थडे है। आज एक और 26 जनवरी रिपब्लिक डे के अवसर पर गुरुजी गुरुमा हमारे को एक गिफ्ट दे रहे हैं हमारे हेल्थ के रूप में। सो आई एम ऑनर्ड टू वेलकम आवर स्पीकर, एन एक्सपर्ट इन द फील्ड ऑफ कार्डियोलॉजी, डॉक्टर एन मुरली कृष्णा. His extensive credentials, including MD, DNB, FCCP, FACC, FS, CAI USA, reflects upon his wealth of knowledge. As a senior consultant and interventional cardiologist at Care Hospital, KIMS, and chief cardiologist at Manipal Hospital, Vijayawada, and with such remarkable career trajectory, Dr. Murali Krishna is well positioned to guide us through the recent trends in heart attacks and impart invaluable wisdom on how to prevent heart diseases. Please join me in extending a warm welcome to Dr. Murali Krishna as we eagerly await for his enlightening talk.
Good morning, all. Yeah. And गणतंत्र दिवस का सबका शुभकामनाएं. And so what a real blessing for our family to be here and take the blessings of Guruji and Guruma. And it's really not only for your Chotu CNG and my son Varun and other birthday boys here. Really, you made a day for all of us, certainly. And जैसा गुरुजी ने बोला, what is Satya is Atma. Don't look at your body. But लेकिन एंड में तो एक सपोर्टिव स्टेटमेंट हमको दिया है, एक खाली विसर्जन, यानी it's not for excreting waste. So there is a meaning for your body also, keep it safe. So that way at least I think I can speak something on body. So what is important component of body is, as you all know, दिल. दिल तो so बड़ी चीज़ है सबके लिए. So दिल के बगैर जी नहीं सकता. So I'll enlighten few things about heart and heart disease and recent trends. And as you all know, like this is the description given by Rawat. This is the classical description. William Haverden, he has described, जिसको हार्ट अटैक होता है, उसका सफरिंग ऐसा रहता है, ऐसा हाथ ऐसा पकड़ के दर्द हो रहा है, पसीना हो रहा है, ऐसा दिल कांप रहा है, चक्कर हो रहा है, ये सब तो हार्ट अटैक का सिम्टम्स हम समझते हैं. These are typical. Haverden angina बोलते हैं, angina जो दिल का जो दर्द होता है वो उसको इंग्लिश लिटरेचर में angina pectoris बोलते हैं. So but this is not classical. So it can be like anything. Like कई लोगों को यहाँ गले में दर्द हो सकता है, कई पेट में दर्द हो सकता है, पीठ में दर्द हो सकता है, कई लोगों को हाथ खींचता है और पसीना होता है, थोड़े लोगों को चक्कर हो सकता है. So these are also symptoms. So we should not ignore. I've seen बहुत सारे लोग ऐसा है, गैस 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 बोल के हमको गैस बढ़ रहा है, जाते हैं इनो वो जो पैकेट में जो मिलता है वो इनो खाते हैं, या तो ओमेज जिसका जो नॉलेज है, सो वो लेके फिरते रहते हैं. सो टाइम उससे बहुत नुकसान होता है. टाइम इज़ वैल्यूबल इन एवरी हार्ट अटैक. एवरी मिनट, एवरी आवर इज़ वेरी क्रिटिकल इन सेविंग योर हार्ट. हार्ट जो है, सो अटैक होने के बाद, दौरा पड़ने के बाद जो है मसल डैमेज होता है, यानी कमज़ोर हो जाता है, पंपिंग कम होता है. दौरा आने से पहले जो सिम्टम्स आपको मिलता है, जो यानी ये जो दर्द या चलने से, आपको सीढ़ियाँ चलने से, उतरने से आपको जो थकापन महसूस हो रहा है आज, यानी रिसेंट हो रहे, वो भी ये दिल का प्रॉब्लम हो सकता है. तो आइडेंटिफाई करने के लिए काफ़ी टेस्ट अपने पास है. ऐसा है 1950s में द बेस्ट ट्रीटमेंट, अमेरिकन प्रेसिडेंट को जब दौरा पड़ा था, यू नो व्हाट ही वाज ट्रीटेड विथ? जस्ट एस्पिरिन. एक 10 पैसा गोली से उसका ट्रीटमेंट हुआ था. दैट वाज द बेस्ट ट्रीटमेंट अवेलेबल देन बाद में ये 60-70 years में it has progressed. The trend has been changed. Treating aspects, a lot of development has occurred. Some sacrifices also has been made. एक great scientist, a German है, उसका नाम है विलियम फ्रॉसमैन. सो ये दिल के बारे में वो जांच करते करते he has made himself a guinea pig. Like he has put a catheter tube. He inserted himself into his heart through his artery, and then to check pressure, how is his pressure is doing. And he ran to the X-ray room, took an X-ray. He made it sure that the catheter went inside the heart. So these were the things our pioneers, our ancestors made. A lot of experiments have been made. So now you get the best of the treatment within fingertips. Like you have a pain, you have doubt, just walk to the next gully. I mean, Hyderabad has more than 150 cardiac centers available all around. So you have any doubt, don't ignore these cardiac symptoms. So it is a killer disease, to tell you frankly. Anything can happen once he sustains heart attack. अटैक मतलब जो मजिल जो डैमेज होता है उससे बहुत नुकसान होता है. सो जो हार्ट अटैक को प्रिवेंट कर सकता है, प्रिवेंट यानी दौरा आने से पहले जो केयर लेता है उससे मजिल डैमेज नहीं होता, हाथ मजबूत रहता है, तो उसको कुछ नुकसान नहीं होता, तो काम कर सकता है. जो चीज़ वो पहले करता था वो सब चीज़ कर सकता है. एक बार पंपिंग कम होने के बाद आपको बहुत फर्क लगेगा. आपको यानी थोड़ा 10 कदम चलने से सांस फूलेगा, तकलीफ होगा, चक्कर आने लगेगा, स्वेटिंग होगा. सो ये सब सारी सिम्टम्स है. सो वन शुड अंडरस्टैंड दिस बेसिक symptom first. So don't ignore whatever it is. If it is gas, you are lucky. Gas doesn't kill at the most. I think you might vomit or you might have some other problems. So make it clear that whether it is acid gas or a heartburn, that is heart related symptom. So this is old numbers actually. Sudden cardiac arrest means people slumping to ground, having chest pain and sudden collapse. This can happen in heart attacks. So because heart gets stunned, blood supply जो heart का जो खून का supply जो एकदम बंद हो जाएगा, एक नस 3 रहता है, इसको coronary arteries बोलते हैं. ये arteries जो है pure blood supply करता है मजिल को. So उसमें से एक बंद होने से भी अपने को suddenly heart रुक सकता है. So more than every day, thousands and all over the world, lakhs of people suffer from this ailment. You can see somebody collapsing in front of you. You must have seen sometimes in the house or in the neighborhood. So, and one should see these are paramedics. They brought an ambulance and they're trying to rescue. So this is called basic life support. These people are well trained with BLS, what's called cardiac massage. And then those things, I think each one of you should be aware of it, and one should learn it actually. So there in the basic school itself, in the medical college or school or other non-medical courses also, BLS is a training given to the paramedics. So one should learn this technique so that the bystanders in the sense when patient collapses to the ground after having a heart attack, people next to there, whoever is there, aware of this thing called cardiopulmonary resuscitation, जो दबाने से, दिल को दबाने से, श्वास को उसको support देने से, I think 1 out of 10 can survive. He can reach hospital. So that is very important. Actually, if there is time permits, I think I can give a demo of that CPR also, those who are interested. Yeah, we have that mannequin. I brought mannequin. How you do it, I'll show it. See, this is a technique called CPR. A person collapses, first thing, keep on the heart lies most of the people on the left side. rarely on the right side, but left side, you keep thumping, keep 45 degrees and keep thumping 100 times. So, so that there is recovery of, cardiac contraction increases once you do this CPR. And respiratory support also has to be given by mouth-to-mouth resuscitation. And in advanced places like this is AED, electronic defibrillators. They're hung, I think, in our modern airports also in Delhi, Calcutta. You find this machine hanging in the walls. It's written AED, defibrillator it is called. So with this, I think the ambulance comes, there is a scope that they can give a shock and save the patient. This is how they carry once he is revived, heartbeat regains, and then with CPR they're transporting the patient to the ICU. The chance of survival definitely increases. So after seeing that emergency, how a heart attack looks and behaves, then what is ABC? One should know the ABC, how to prevent these heart attacks. So avoid. Avoid these things. One is tobacco. Second thing is stress, high blood pressure, high blood cholesterol. And B is physical activity. Reduce the stress and control the blood pressure and control your weight. And C is alcohol. This is choose good nutrition. Alcohol is not good nutrition. I mean, choose good nutrition, low fat, low carb, and healthy diet. So this is just what is heart attack grill means, how you invite by choosing your diet. This is a slide showing that. You know what is bypass. Bypass is an operation where, we add one artery. So single bypass burger and double bypass. So this is a flatliner. Like this, like you choose how you invite, the fat into the body. So this is the it really useful pyramid actually. So make a healthy living by having a healthy diet, healthy living, that is exercise, and reduce stress, जो Guruji हमको दे रहे हैं. So forget everything, forget your responsibilities, lessen your stress, mental stress, and that gives you a real relaxation. So stress is equally important risk factor nowadays. We feel only having hypertension, having diabetes, obesity, family history. These one feel that these are risk factors. Stress is equally a risk factor. That by doing this meditation, yoga, and all that, by changing the lifestyle, definitely सबको इसे दूर रख सकता है. Then of course the menu is given. You don't have to go detail. Just low-fat food and fried foods should be avoided. Oil should be avoided, and then more vegetables, and then healthy foods, green leafy vegetables. These are the grading. Good. These are what are good, what are okay, what is to be avoided. See, frosted cake, cheesecake, pies. These all should be avoided. So the cholesterol levels in the blood will be maintained, and the chance of your arteries getting clogged is reduced. And of course, for non-vegetarians also, what is good, what is bad. Like fish is okay, and then some to avoid all these high-fat meals like organ meats and other things. So again, healthy living. So basically, this kind of meeting, reducing your stress, and cultivating ये जो habits what we are doing is to relieve stress. Why are we here on a holiday? And you're just feeling relaxed here. So among exchanging your ideas or something like that, just change your lifestyle, relax. Don't take anything to your mind. Whatever what is destined to happen will happen. So you live for the day and then forget, keep planning for next generation or next 2 generations. वो सब भूल जाइए. So great people also could not, having billions of rupees also, they could not buy lifetime, He's hardly, I think, 50, reached 50. And by the time he called 9/11, and then he is no more. So I think what killed him is a mystery. Some say that drugs and other things also causes heart attack. So he used to be, he used to live in hyperbaric oxygen. That oxygen जो chambers रहता है, उसमें सोता था क्योंकि he wanted to live 100 years. So but nothing. Ultimately, he lost his life at very. So the mystery of heart attack. Yes, this is the basic heart. One knows that, and what is crucial. These are the things. What you're seeing, the red lines. These are arteries. Artery is a tube-like thing. Inside, if you cut it, it should be clean like this. And this is a blood clot, and this is a cholesterol deposit. So heart attacks occur for mainly erythematous plaques, that is cholesterol deposition in your arteries, which are lying over your heart, that is epicardium, what we call. Over the heart they run, 3 arteries, they supply blood to the muscle. Heart muscle को ये खून पहुंचाने वाले नस है, 3 नस रहता है, इसको arteries, coronary arteries कहते हैं. So they are pictorially depicted like this. And once it is, you see here the black thing is the obstruction caused by cholesterol deposit. So there the muscle is lost. Once muscle is lost means heart तो कमजोर हो गया, muscle pumping कमजोर हो गया. So ये अभी जो देख रहे हैं, it should be clean like this. The artery should be like a pipes. So you can see the difference here. It is narrowed, the circle portion. That is a block. That is a significant block. This is detected by a procedure called angiogram. Angiogram बोल के टेस्ट करते हैं. Angiogram में मालूम पड़ता है. ऐसा एक ब्लॉक रहा, उसको ट्रीटमेंट खाली स्टेंट से वो क्लीन कर सकता है. ऐसा 3 या 4 और उससे भी ज़्यादा है तो बाईपास कर सकता है. और सब लोगों को बहुत पतला हो जाता है, उसको दवाई से ही काम चलेगा. सो अलग अलग सिचुएशंस में अलग अलग ट्रीटमेंट्स रहता है. ये जो आपको दिख रहा है, दिस इज ऑलमोस्ट क्लोजिंग द आर्टरी. हियर इट्स नॉर्मल, हियर इट इज नॉर्मल. You can see the deposit, fat deposit, cholesterol deposit. So the black thing, what you are seeing is muscle, dead muscle here. It is not healthy. So इसको तो दौरा पड़ गया. So how to do this angiogram? Just basically for you, I quickly just go through. So this is the heart. So दिल को पहुंचाने के लिए हमको रास्ता जो है, so ये यहाँ जाके ये आर्टरीज कैसा है उसको फोटो निकालना है. तो उससे मालूम पड़ता है कितना ब्लॉक्स है, परसेंटेज ब्लॉक्स कितना है, उसको क्या करना चाहिए. इसको ये डायग्नोस्टिक टेस्ट है, इसको एंजियोग्राम बोलते हैं. इस अप्रोच से फेमरल मतलब आपको ग्रॉइन से करते थे. दिस वाज 10 years 15 years बैक. People used to insert a small tube inside and then we used to take photographs. Now most of the procedures, 99% is done with the hand now. बहुत जगह all over India we do only radial procedures and rarely brachial approach that used to be done 30-40 years back. Yeah, this is the catheter inserted and you can see the black thing gone up to the heart and then it has engaged, thereby giving a contrast here from the periphery. यहाँ से एक इंजेक्शन देते हैं, वो इंजेक्शन से वो आर्टरीज हमको दिखाई देता है कैसा है, क्लीन है या साफ है या का कुछ ब्लॉकेड है. So this is how a coronary artery, coronary angiogram looks. So you'll have left side 2 arteries. This is a normal main artery. It divides into 2. These are the 2 and side branches. All small things you are seeing is They're all, small arteries, branches of main arteries. Main arteries are basically three. Left side दो रहता है, right side एक रहता है. So similarly, we can do a brain testing also. This is brain angiogram. We can detect brain stroke, paralysis. वो सब इससे मालूम पड़ता है. Brain का भी angiogram कर सकता है, carotid angiogram और cerebral angiogram. वो करके blockade है तो उसका भी treatment है. So यानी paralysis आने से पहले ही ये recognize किया तो ये blocks है बोल के उसको इलाज करने से वो we can prevent strokes, brain strokes also. And again, the blockade can be in your legs also. Some of the smokers, they'll be having lot of pain. चलने से उसको पकड़ चल नहीं पाएगा क्योंकि इसको पूरा दर्द होता है. So these are blocks in legs. You can see. So usually we see in smokers. The blockade can occur right from head to the toe. So you can develop blocks because of atherosclerosis, cholesterol deposition, anywhere. And we can see the kidney thing also. These are your kidneys. The structure you are seeing is, both kidneys. We can assess how is the circulation to the kidney. Kidney का circulation कैसा है वो भी देख सकता है. कई लोगों को इसको kidney को भी stand पड़ता है. उसको भी वो रहने से उसको बीपी बढ़ जाएगा, दर्द होता है, किडनी का फंक्शन कम हो सकता है, तो उसका भी स्टेंट कर सकता है, वो भी एक प्रोसीजर है. And you can see the normal artery above. This is a normal. If you cut it like this in a transverse section, this is cross section, this is the normal. So once you have cholesterol deposit, you can see this yellow thing, the whole thing, it is occluded almost 50 to 60% is blocked. So what after knowing the blockades, like what are the techniques, what are the methods we have? So we can manage with medicines, we can manage sometimes by surgery, bypass surgery. Alternate management is balloon angioplasty, by clearing the blocks with, just now I met one of our friends 3 months back underwent and 2 stents were put. He was asking me some question. I'll answer to you later. So balloon angioplasty, see, like if you have, this is almost 100% occlusion, you see, this is normal, this is blockade, and here is near total, almost occluded. We can clear it. So you can see a balloon catheter is passed into the artery and inflated, and over that what you see is mesh-like thing as a stent. वो स्टेंट वो क्रश करेगा, वो कोलेस्ट्रॉल जो है उसको स्क्वीज करके वो पूरा ऐसा नॉर्मल जैसा बन सकता है, यानी सर्कुलेशन क्लियर हो जाएगा वो स्टेंट डालने से. जो आपका जो ब्लॉकेड है, ये जो ब्लॉकेड ये स्टेंट डालने के बाद वो एक्सपैंड होके पूरा वो खून तो नॉर्मल हो जाएगा. Just to show you how a stent looks like this, if you hold with 2 fingers, it's a small thing, stainless steel. It is nowadays coated with drugs and different drugs, everolimus, sirolimus. These are the drug-coated stents are put normally. Earlier there used to be bare metal stents. Now drug-coated stents are giving excellent results. 10-year follow-up compared to surgery and stenting. People ask us how many years. First thing they ask is, कितना साल काम करेगा ये स्टेंट डाले तो. So they keep asking us, guarantee is one thing and what is longevity. So nobody can predict what is longevity because they have to take the regular precautions, like maintain your diet, take medicines regularly, and then do exercise. So that the fat accumulation, whatever we removed fat inside, that should not reach again. So stents, we have seen people getting stents in the first generation, early 90s, 94 was the era of not drug eluting, bare metal stents. सो उसके पहले बैलून्स ही था, खाली बैलून से डायलेट करते थे 80s में, लेट 80s में। अर्ली 90s में ये बेयर मेटल स्टेंट आया, वो बैलून के ऊपर वो स्टेंट चढ़ा के सो उसको ब्लास्ट करते थे। अभी लास्ट 20 ईयर्स डायरेक्ट बैलून माउंटेड स्टेंट्स आ गया, ड्रग एल्यूटिंग लेटेस्ट स्टेंट्स है। सो दे आर वेरी इजी टू डिप्लॉय। द प्रोसीजर टेक्स हार्डली 10 to 15 minutes, single stent. If it is a very complex procedure, lot of things have to be done. We have to do cutting and then lot of things, and still we can open up the closed vessel. And that improves the circulation and gives you longevity of life and quality of life. And even bypass, what they say is, bypass is a palliative. Palliative matlab, it is not curative. What is curative is if you have a lump, you remove it, that's cured. You have malaria, you treat, malaria is cured. That no more infection inside. But these are palliative. Palliative in the sense you are just, disease is there inside, you are bypassing. So you are relieved of your chest pain, you are relieved of your breathlessness, your quality of life is improved. Whatever you could do earlier, after doing this, you will be able to do that. So quality of life is important. So block रहने से क्या होता है, your restrictions will be there. You cannot exert yourself. You have to limit. एक सीढ़ियाँ नहीं चढ़ सकता है. One story you cannot climb. You have to stop. Even for walking also briskly. 10 steps के बाद में 10 कदम के बाद रुकना पड़ता है. So that will be definitely quality of life will be improved after this. And we have seen stents deployed some 20 years back also still working well. There is one thing called restenosis. Restenosis means about 2 to 3 after drug-eluting stents have started come into the market. The restenosis means even after clearing the block, about 3 to 5% of the arteries again gets blocked. 3 to 5. Remember, 97% they remain patent. So even for surgery also, post bypass, normally we expect 10 to 15 years lifespan. But for some, after 3 years, 4 years, again they do develop blockade because of their body tendency, and then they have that lineage for cholesterol deposition in the body. So keep your heart safe and healthy and happy. Yeah, you are open for any doubts or questions you want to ask or clear. Yes, sir.
Good afternoon, Dr. Garu.
Yes.
I'm 72 now. I have about more than 3 dozen of my friends who are specialists in different fields. They are doctors. So what happens in 2020, I was walking with my friend in Bangalore. So he told me, Bansalji, now recent technology has come whereby you can protect your heart by going for the CT angiogram. My mind is a monkey mind. So it was just stuck in my mind. I came to Hyderabad and one of my friends who is a doctor, I told him and he just laughed at me. He told me that, okay, I'll go with you and I'll see that we'll get the best CT angiogram done. That radiologist was very famous actually. So we went there and he did that CT angio. Now we have to go for angiogram also, this and that. I was had that fear and all. Then I met one of my friend, Dr. Jivani, you must be knowing.
Murali Jivani, Kim's.
Yeah,
yes,
Kim's.
yes.
Yeah, he's my friend.
And he's close friend of C.N. Rao Saab.
Oh, good. He told me, Bansalji, I just take your physical these things, and then he told me you have to take 2 medicines continuously. Okay, no problem. He gave me 2 medicines, one Tigatel 40 mg and one Rojocor ASP 10 mg.
Okay.
So still I was not comfortable. So then I met Dr. Raidu. He swims with me in Jubilee Hill Club.
Okay.
So I told Dr. Garu, this is the thing, unnecessarily in my mind I'm having a little tension. So he told me, come, I'll have that CT angiogram. And it is a matter of 10 minutes only. And Dr. Gokhale is also my friend. So he also told me it's better you just live from my mind. So he did my CT angio. Not CT angio, regular angiogram. So while doing, he told me, Bansal, your heart is as good as 50 years boy. I'm not going to put any kind of stunt. And then I came back from his operation theater. Then he told me the same medicine you have to continue. He says for the future precaution only. What happens when I was swimming, I was putting extra things in my legs. So I get lot of cramps. And it was so horrible, I was unable to even stand also. I thought that something is wrong in my swimming. I suffered literally 1.5 years. And one day I got some intuition that why not you go to Google and see that what is the actual, these medicines side effects. And I was shocked that muscles cramp and back pain and all so. Then I met Dr. Anjanailu, he is my friend, cardiologist, you must be knowing.
Yes.
So he told me, Bansal, you throw these medicines for 1 week and record your BP in the morning and evening. And come back to me after 10 days. And to my surprise, it was absolutely normal. Morning when I was at bedridden, it was just 120/70. And night at around 140/80. So he says they don't take any medicine. My simple question is why the doctors are pushing unnecessary medicines in the body? When the person is normal, I never had any BP in my life. My lifestyle is very simple. I never go to the restaurant for the past 30 years. My living is very simple. I work out in the morning at 2 hours continuously. But of course, I'm a little short-tempered person. So, ultimately, I suffered a lot and now I'm happy that I'm not taking any medicine.
So you have undergone CT angio later. First conventional angio was done as per recommendation of NV Raidu.
No, first CT angio.
CT angio was done.
Yeah.
So what was the calcium score?
This is more than 70%.
Calcium score is 70
Yeah.
and blockade is more than 70 or blockade?
No blockage.
Okay. No blocks, they recommended these two drugs.
Yeah.
And then what made you to undergo coronary angio again?
Because of my mind that if something goes wrong means then what will happen?
So you're asymptomatic and active person, can able to swim and then do your physical activity. What made you to do visit a cardiologist? Jivani ko aap kyun mile?
See, I met Jivani because immediately after that CT angio.
नहीं, आप डॉक्टर के पास क्यों गए पहले?
See, I told you, my mind is monkey mind. If something says to me that Bansal, it's better you go to the doctor for this thing and that thing, I'll go simply.
Yes.
So that's my habit.
Yes, sir.
Now even my wife also says that don't go to the doctor, it's very scary.
Okay.
So
Yeah, I'll answer to that, sir.
yeah.
And you're not diabetic and you're not hypertensive.
I'm diabetic, but it's well in control.
Okay.
Yeah.
So once you cross 60 or 50, whatever it is, I think some mandatory screening tests are there. Screening tests, जैसा आप sugar test करते हैं, BP checkup करते हैं, वैसे जो cardiac के लिए जो basic screening test है, echocardiogram, that is a heart scan, and then the basic thing is stress test, treadmill testing.
Yeah.
So that was it done?
Yeah, that was done.
Was it positive?
No, it was absolutely normal.
Negative.
Yeah.
So negative TMT or negative stress thallium, they are indirect tests to say whether you have any significant blockade inside or not. So suppose you have 50% blockade inside one of your arteries. Definitely the treadmill, once your heart is stressed, वो 50% blockade से थोड़ा changes आता है वो चलने के बाद. जैसा ट्रेडमिल में जो करता है हम हार्ट रेट को बढ़ाता है. जैसा आप नॉर्मल हार्ट रेट 70 है 120 130 तक आपका हार्ट को, सो उससे अगर ब्लॉक रहा वो ईसीजी में फर्क आ जाएगा. So if it is negative, absolutely no need to go for further testing.
Now, even 6 months back, I got it done.
Okay.
Yeah.
So, like You said you have monkey mind.
Yeah.
And doctors also have similar mind, you know, they are also humans. I recommend only one thing, like if you have risk factors like diabetes, hypertension, if you are 60 plus,
I'm 72 now.
yeah, if
Yeah.
you are 60 plus, go for a simple stress testing. If it is negative, just forget. Control your BP, control your diabetic. And diabetics normally they give for prevention. It's a routine practice, like a blood thinner and a cholesterol drug is given.
Yes, sir.
Even if your TMT is negative also, to prevention. This is to prevent heart attacks or prevent blockade progression. So that's given. And then, and CT angio is not the direct thing. Go for only calcium score assessment.
Yes, sir.
CT calcium. CT angio is a very cumbersome test. Your heart has to beat less. They give you drugs. They make you lie down. Breathing exercises. You have to stop breathing.
Yeah.
It is 10 times tougher than routine angiogram.
Correct.
You must have experienced that
Yeah,
difference. People that CT angiogram means very simple. It is non-invasive. Actually, nothing.
Yeah.
वैसा बोलते हैं, it's misnomer, misconcept. Okay, only just go for CT calcium. If your calcium is 0, just don't get anything done. If your calcium is positive, say even if it is 50, 60, 70, like you said 70,
Yeah.
so go for angiogram.
No, I already did it.
Yes, you underwent angiogram. There they detected a plaque. Okay, plaque in the sense there is a cholesterol deposit is there.
Yeah.
So for that reason, they have recommended rightly. This is a international guidelines, ACC, American Cardiology, or International Cardiology, or Indian Heart Association guidelines. Once you have any plaque inside, to prevent heart attacks in future, prevent progression of this atherosclerosis, one has to take statin. Statins are many: atorvastatin, rosuvastatin, pitavastatin, simvastatin. There are several statins are available in the market. And the Google search you must have recognized the percentage of people having muscle pains. It's very less. Very less. For any drug, there is a side effect. Even if you have crocin, there is a side effect.
Correct.
Crocin usage can cause you some kidney problems sometimes. Sometimes. It's a very rare thing, but very harmless. Statins long-term usage, you have to monitor your liver functions, blood counts, and again tolerance, like you have muscle cramps because of statin usage.
Yeah.
Once you have, earlier we used to use a statin called simvastatin. That used to be horrible.
Okay.
Almost 60-70% of the people used to develop muscle cramps. So later we switched over to atorvastatin. Atorvastatin is slightly better. But now most of the people, there's a trial called Jupiter trial, which showed very good results after bypass, after stenting. If you use this rosuvastatin, results they compare using atorvastatin with rosuvastatin. And rosuvastatin, the survival rates and results are very good. And rosuvastatin, initially after stenting, we give high dose, that is 40. And then after 3 months, we reduce it to 10. So usually with 10 milligrams of rosuvastatin, nothing, we see 50 to 60 patients every day. All of them are on statins. That means millions of patients all over the globe, they are on statins.
Yeah.
But if you have, some are very sensitive. The muscle cramps, what you're getting is because of statin only. There is one statin which is available, but rarely you have to get it. Pitavastatin. Pitavastatin is one, the incidence of muscle cramp is very less actually. We do recommend that, and that is also equally effective. And statin is a must once you have a plaque. Otherwise, you have to aggressively swim, aggressively do exercise, and then that plaque inside should not grow.
No, Dr. Garu, I don't have any blockage, but I always feel that at this age, my doctor says that you should have some precautionary tablet so that in future if something happens means you should not have any kind of problem.
And no, sir, your calcium score is 70, and CAG definitely, I think there must be even 30%, 40% blockade they must have detected. Check your annual report. You can WhatsApp to me.
Yeah.
Definitely, I think 30% blockage or 20% blockage, mild atheromatous blocking is there.
Yes, sir.
Definitely statin is indication. Your doctor rightly recommended, but only thing unfortunately it didn't suit you.
I'll take down your personal number and...
yes, sir. Forward me your CAG report or
my
CAG.
latest reports and all.
Yes,
also,
sure.
Thank you, sir. So nice of you.
Yes, right.
Good afternoon, my dear Dr. Garu.
Sir.
I am Mr. Krishna here. Aged about 77 completed. So, I want to ask one question. How to detect the difference between the gastric problem and the heart problem? That is very, very important. Because the other day, 2-3 days back, I had a pain on the right side of the chest. But since afternoon to evening, I could not resist. I have taken only one acidity tablets, something.
Okay, sir.
After some time, it was reduced. Previously, a pacemaker was installed 4 years back in 2019. So pacemaker is working. Recently, I had been checked also because it is working properly. Still, the time is there more than 10 years.
Okay, battery time.
Battery time. So it is working properly, and I got checked also with all these things.
Thank you.
Lipid profile, everything. Recently, in the month of December, I have undergone all the tests, and doctor said everything is okay. But how to find out the difference? Because if it is a heart problem, we should rush up to the hospital. As you said, the time is very valuable. But if it's a gas problem, I don't think it's not necessary to go to hospital. How to differentiate? That is very, very important. No?
So in your case, you underwent permanent pacemaker implantation, say about 3 years back.
4 years back.
4 years back. So before implantation, normally after age of 60, we do coronary angiogram. That time it must have been done, and absolutely they must be normal.
Angiogram was done at the time before installing the...
Yes, that we do. That is mandatory test. We look at the coronary arteries, whether there is any blockade or not. Sometimes this conduction abnormalities. Pacemaker is implanted basically if you have giddiness, okay, palpitation.
PR rate has come down to 28.
28, you fall down, you throw fits. So for that actually, first test we assess your coronary arteries. How is your heart circulation? So angio must have been done to you. That must be absolutely normal, or mild blockade is there.
There were no blockages at all. What doctor
so what you are having is a acid peptic disease. So assuming that your coronary angiogram is normal that time, because they do 100% wants to do angiogram before pacemaker implantation. Check your angiogram. If there are no blocks, even if you get any pain anywhere, don't forget,
But it is 4 years back, no?
No, that's what. So fast the disease doesn't progress. Unless you have at the time of implantation, you have a 60% block.
Yes.
Okay, 60% block is managed medically only. Only they implant pacemaker, leave it.
Okay.
Check your angiogram at that time. You must be having the report with you.
Okay.
So if there is no blockade anywhere, 0 or 10%, 20%, so that means you are not having this heart angina.
Okay.
Get an endoscopy done. Upper GI endoscopy, OGD. So get it done. If you have any reflux esophagitis, gastritis, these problems can be detected by the simple test. It takes 5 minutes for this gastroscopy. And then check your angiogram. If it has 60% block then, 4 years back, then you have to immediately rush to a cardiologist.
No, there are no blacks at all, as doctor said.
So assuming that what you are saying is 100% correct, that is a gas pain.
No, there is a gas pain. How to know it? Because we are not professionals, whether it's a gas pain.
Yes, sir. ECG changes will be there. And if you have ECG pain, if you go to ER, they take a ECG first thing within it.
No, what is the precaution that we have to take, whether going to hospital or not?
No. We know your background history.
It's not me. In general.
In general, suppose they have not undergone testing. If they have any risk factors, hypertension, diabetes, or anything like that, get a ECG, basic ECG done, and then usually the clinical acumen will judge whether it is acid pain or a coronary pain, angina pain. Sometimes ECG may be normal, some blood tests, if there is a muscle damage, and then it is heart-related pain, what are called troponins. These are enzymes. Okay. So the test is done in emergency itself. The result is out within 15 minutes. If troponins are elevated, these blood markers are elevated, that means you are having that heart pain.
But anyhow, we have to go to the hospital.
Yes, yes, yes. Don't
We are-
ever neglect any sort of pain. Don't neglect pain. It is a killer disease.
No, if it is on the right side.
Right, left, back, throat. I told you, no?
Okay, okay,
Don't assume it is heart pain. It is not heart pain.
okay.
Just make it confirm yourself that you're not suffering from heart problem. Don't take risk.
Okay.
You have to rush.
No, some doctors
But knowing
say-
your history, give me your feedback. That is definitely go get a endoscopy done. Usually, you must be having some esophagitis.
What doctors say is that you be careful about the chest pain when there is a pain, especially in the center of this part. But sometimes when it is a pain on the right side, is it necessary?
Yes, sir. I showed in my slides. Atypical presentations are like that. It may not be classical left side pain. You can have right side pain. You can have throat pain, abdominal pain, back pain, shoulder pain. Sometimes reeling sensation, sweating. Several symptoms. These are called atypical chest pain. Okay. It is atypical also. Don't neglect. Get a basic ECG done. Don't sit at home thinking that gas, gas, gas. I've seen 50% of the patients coming to me like they are basically from the lower income or middle income group. They don't want to rush to hospital and spend money. They can't afford also. I've seen them 50%. They come to hospital after having heart attack, thinking that it is a gas pain. They approach us after third day, fourth day, because it's not getting relieved. They're having other problems like giddiness, weakness, unable to walk. So their relatives carry them to ER. We take ECG, it's a heart attack. He was thinking that he's sitting at home, it's a gas pain. He goes on consuming gas tablets and
So now I am using atorvastatin 10 mg and clopidogrel 75.
so make sure that your angiogram is sure. Sir, I'm not sure because these two are given even if a small percentage of blockade is there at that time.
Okay.
Send me your angiogram.
Okay.
And if there is 10% block also, you have to continue those two.
Those two things.
Yes.
Okay. Thank you, doctor.
Hello. Hello. Excuse me.
Yeah, please.
First of all, an excellent speech on a right day to take care of our heart.
Thank you.
Thank you very much, sir. Small clarity, sir. I have been taking this BP test every time in my house only. Earlier, this Google Baba used to say that, as we grow older, there's a tolerance towards BP also. That means it need not be 120, it can be more. Similarly, the lower one also can be slightly more.
Yes.
But now the whole concept seems to have changed, sir. Now they say that even if it is 70-year-old, the BP has to be 120 by 80. Can you throw some light? Why this change in what do you call as the standards?
No. There are guidelines again, international guidelines on classification of hypertension. Hypertension is classified as high normal and stage 1, stage 2, stage 3. So high normal, earlier they used to say 140 by 90. Okay, that's a high normal means like you are just prone for going into hypertensive disease. Stage 1 is diastolic above 90 and systolic above 140. And stage 2, 160 by 100. Stage 3 is diastolic pressure more than 120. That is hypertensive emergency. So there are classifications, definitely indications also. Even the guidelines, there are relaxation actually. Earlier they used to say stringently, systolic has to be 140 for any age group. But now, age group of 60, 70, there is thickening of their vessel wall. Arteries, they get thickened. Their systolic pressure is 160, 170, it is acceptable. But diastolic should be less than 90.
Sir, somewhere I was reading, sir, maybe you can guide me well.
Yeah.
They say that no, irrespective of the age, now the new concept is you have to maintain still 120 by 80. Why? Because this medication field is trying their best to see that everybody starts taking medicines if it is of a higher, BP level?
No, 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 it's not mandatory, sir. You have to what? See, I have not invented hypertension. मैं तो hypertension को invent नहीं किया. It's an age-old disease. It's been there for centuries. So we go by guidelines. There are guidelines for everything. Like आप सड़क पे जाना है तो guideline is that 60 क्रॉस नहीं करना चाहिए speed limit. Okay, ORR पे तो exemption है 100. ऐसा है BP का भी guidelines है. BP 140 you can relax, 140 by 90 for age of 50, 140 by 90 is only high normal. So these, you don't require drugs. You require only salt restriction and lifestyle modification, like you have to do exercise. And science has proved that yoga meditation decreases your systolic as well as diastolic pressure. So you have to inculcate those good habits. And don't worry, no guidelines have given 120 has to be kept for all patients. No. You go through Google again, there are guidelines again, AHA guidelines about hypertension. AHA is American Heart Association guidelines. Okay? These are guidelines created by a consort of people, experts, and KOLs, okay, opinion leaders in the field, cardiology. So known opinion leaders, KOLs, they decide, okay, we have to treat this patient. Once your systolic pressure is 150 and diastolic pressure is more than 100, the end organ damage is definitely is going to cause you over a period of time. End organs means your vision get affected, your kidneys might get affected, and then there may be heart might. So to prevent that end organ damage, BP is not a disease. It causes diseases. Hypertension is only like a diabetes. It's not a disease. It causes diseases. It is leads to diseases. Hypertension, you can have a heart-related issues. Hypertension, kidney-related, vision, brain. All these things are caused by uncontrolled hypertension. So you can review your guidelines. You take that AHA guidelines on BP. There are classifications. There are classification of hypertension. Clear. It is very simple. I can show it on my this thing also. Just check AHA.
Thank you.
Thank you, Doctor. Very nice speech and enlightening. Like Guruji has enlightened us on the mind side, so you enlightened us on the heart side. Just one question on, in terms of the checkups, the regular checkups for a 55 plus or a 50 plus person, even if you're doing fine, heart related, what are the checks that you should do and at what frequency? That will help.
Yes, sir. See, suppose you are 45 plus and not having any risk factors. You're not obese, you're not having hypertension, you're not having diabetes, you're not a smoker, you don't have family history of hypertension. So just get your mandatory BP, sugar regularly checked up. So once you have one of the risk factors, hypertension, diabetes, or any other risk factors, get a treadmill done, get a echocardiogram done, and frequency, if they are normal, frequency at a 3 or 5 years interval. So once you detect some changes, then you have to go for advanced testing. So similarly, we have guidelines for cancer screening for ladies, once they cross 40, you have to screen for cancer, cervical cancer, breast cancer, like that, We recommend cancer screening for ladies. Similarly, for men also, screening for heart, screening for your prostate. Once you are 60, 65, you have urinary problems, screen for that. The PSA is a one blood test, whether you are having a prostate cancer. These are all screening tests. There are a series of tests where you can take. The doctor, your family physician will help you in guiding you. You are a healthy person, nothing. Go meet him, get your BP checked up, get a sugar checkup, go home.
Thank you. Thank you, Doctor.
Yeah. If there are no more... yes, sir.
आजकल बिना मोबाइल के हम 1 मिनट भी रह नहीं सकते हैं, उसके रेडिएशन बहुत डेंजर है बोलते हैं। तो जो शर्ट के पॉकेट में हम मोबाइल फोन लगाते हैं वो कितना डेंजर है?
Yeah, actually, even I am as knowledgeable as you because, of course, radiation emission is proved definitely by there are gadgets available. How this radio frequency, this thing can be monitored by using gadgets. So simple, even charger also emits some radiation. So that thing, of course, so far I think no untoward this thing. We recommend they have undergone some pacemaker implantation. They have some rhythm problems. Keep away from your heart. Keep it in your back pocket or down, not close to the heart. So that's the only knowledge we have so far. Maybe in future some controlled trials. People without using mobile, people keeping mobile. Then if you study 5 years, what are the results? How are they, how is their health? So that this kind of scientific trials, they help us.
Okay.
Yes, sir. About your hypertension, you read in Google. Values, yeah. Yeah. This is high normal, I said, no? So 130 to 139. So keep it. 140 is the target, I said, no? So then it is high normal. That means you are going close to being branded as a hypertensive. So diastolic up to 90, below 90, keep it. 140 by 90. These are guidelines. So nobody says that 110. Okay? This is AHA guidelines, International Society of Hypertension. International Society of Hypertension, they have given these guidelines. So this is grade 1, grade 2. Grade 1, systolic pressure between 140 and 159. Diastolic blood pressure 90 to 99. No other risk factors. They have moderate risk. Then modification is required. This is grade 2 is above 100 diastole. So they have to take care. They end up in having problems. So nothing. That 110, 120 is a myth, I think. I don't know which Google has given. Yes, madam.
But nowadays you see youngsters, they just collapse within 5 minutes. We have got a family death also. So what could that be the reason?
Yeah, of late you've been seeing physically athletic person going for a gym, workouts, heavy workouts, absolutely looking, basically a fit person. They also, you must have heard about few film actors, few figures, politicians crashing in gym. So this happens normally. They're not perfectly having absolutely 100% normal health. There are two possibilities in them. One are born with some congenital anomalies. Congenital means so these heart arteries lie over heart. Means if a heart is like this, these arteries run like this. Over the heart they're not inside. So for some, by birth, what happens? They run an abnormal course. They run through muscle, heart muscle. Okay. So these people, they keep, having symptoms when they exert themselves beyond what is this thing. Severe exertion can cause angina because of coronary steel, they call. Because blood won't reach muscle because it is getting crushed. That is one theory. And common theory and most acceptable theory is you have a 50% plaque. Plaque in the sense that the atherosclerotic deposit is there, 50% only. That won't cause you, even if you run also, cause anything. You can do treadmill will be negative. So, but the morphology of the anatomy of the plaque, if it is not smooth, it has abnormal borders, it is rough. The cholesterol inside accumulated, if it is irregular border and if it is rough, what happens? Suddenly the blood passing through gets clogged there. So it causes sudden total stoppage of blood supply. This is called plaque rupture, what we say. that cholesterol deposit gets cracked. Cracked and that plaque rupture occurs and then suddenly they crash. So this is scientific explanation given, plaque rupture. The cholesterol plaque, it gets ruptured and blood gets stopped there. Yeah, heart attack is muscle damage. Yeah, that's what I'm going to show. Okay, once your heart is stopped, so you see patient just falls to the ground, and if you just check his pulse, nothing. You just put your ear on his chest, there's nothing, no sound. Then just go bend down and keep your thing like this. Yeah, volunteers will do later. Just see this at 45. Don't bend your this thing. Keep compressing like this. Fast. For every 100 thumbs, give one mouth to mouth. So, respiration is 20 times per minute. Heart beats 80 to 100 times. So, for every 100, for every 5, you give one respiration, mouth to mouth. This is CPR, cardio pulmonary. So, by just learn how to do, it should be very effective. You are compressing the heart. So your heart is, by your compression, the blood is coming out, reaching organs. That is the reason. Compress it as hard as you can. Sometimes we break ribs also. Yes. But patient will survive. Only ribs are broken. So keep pressing, Yeah.
Doctor, one last question. If there is any brain clot, if there are any clots in the brain, is it possible to release them without any medical procedures?
No, actually, if you identify a clot by MRI or CT, normally MRI is a test done, the brain clot is there. Depending on the size of the clot. If clot is only mild clot, they're given by dual antiplatelets and a statin. We give drugs, blood thinners and this thing. With that, mild clots will get cleared. There are some drugs, emergency medicine called tenecteplase, retiplase. These are injected into them. They're clot busters. So it will immediately dissolve the clot and it will prevent brain stroke.
Thank you, doctor.
Yes.
Thank you for all the myths you have broken and जो हमारे इतने सारे doubts आपने clear किए और इतना time हमारे सबके लिए निकाला, we are very thankful to you.
Yes.
हम सबके काफ़ी doubts clear हुए हैं और जो डॉक्टर को अप्रोच करना चाहते हैं आज के बाद भी आप उन्हें अप्रोच कर सकते हैं, अपने डाउट्स क्लियर कर सकते हैं. गुरु माँ के साथ हम सब भावना के साथ जुड़ेंगे जो सम्मानित करने जा रहे हैं डॉक्टर को.
One more thing, because you all have witnessed what is the basic life support, BLS, and we on our behalf from our organization, Manipal Hospital, Vijayawada facility, we're going to give you certificates. You can collect them because now at least basically, though you have not practiced, you know how to. I think if you have any doubt, you can come and practice here. Mannequin is there. You can practice that and then go back and save some lives.
Thank you.
Definitely. And we brought certificates. We'll be handing over to the in charge. Yes, sir. Yeah. Just basic drugs are, one is blood thinner, aspirin or a clopidogrel or a ticagrelor and a statin and sorbitrate. Just keep them emergency. If you're already patient of heart, just carry along with you in a kit. Normally when I travel, because I am a doctor, I know what are the basic things required for a cardiac arrest patient. Yes. If you're flying, the in-flight, there is a kit is there. Immediately any doctor is there, he'll get that kit and give you induce. And it's better to carry after age of certain age when you have prone for these heart ailments.
Thank you.